So what is Monteggia fracture? Monteggia fracture is a fracture of the proximal ulna associated with subluxation or dislocation of the superior radial ulnar joint. This type of fracture mostly affect the forearm and elbow and may also affect the wrist.
Now we continue to range of motion exercise. This is also known as ROM exercise that to improve movement of the specific joints. ROM can be divided into three types, which is active range of motion, passive range of motion, and active assisted range of motion. And the purpose for the intervention is to reduce pain at the fracture sites, to increase grip strength, to increase flexibility, to increase range of motion, and to prevent contraction formation. For the theory, this exercise aids in slowly extending its joint range of motion. Joint movement on a regular basis can help with pain management, joint flexibility, maintain strength and balance movements. It also helps to keep joint and muscle flexible and gradually widen their range of motion while reducing discomfort, bruising, and stiffness.
Next, we will look into the procedure of intervention for range of motion exercise. Elbow range of motion exercise consists of four types of movements, which are flexion, extension, pronation, and supination. Passive range of motion (PROM) is referring to the movement where the joint is moved by an assistive device or by a therapist. For elbow flexion and extension, ask patient to sit on a chair with their back straight and feet flat on the floor. Ask them to rest their arms down by the sides in supination, as the therapist will support the patient's upper arm and wrist. Slowly, bend from the elbow and have hand touch the shoulder if possible. For elbow extension, therapist will slowly straighten the elbow. For forearm pronation and supination, ask patient to sit on a chair with their elbow supported on a table with the hand in a handshake position. Therapist will grasp the patient's hand like shaking the hand. Slowly, turn it to a palm down position, so the palm facing the floor for forearm pronation. Then, return back to the starting position. Slowly turn it to a palm up position, so the palm facing the ceiling for forearm supination. Active Assisted Range of Motion (AAROM) is referring to the movement performed by the patient with the assistance of the therapist. Repeat the same procedure as before. For this movement, the therapist will tell the patient to bend their elbow, but when the patient stops doing this movement, therapist assists to complete the full range of elbow flexion. Next, does the same for elbow extension with the elbow straightened. Repeat the same procedure as before. For this movement, tell the patient to rotate forearm inward so the palm facing the floor. When the patient stops doing the movement, therapist complete the full range of forearm pronation. Then, return back to the starting position. Next, does the same for forearm supination with the forearm outward so the palm facing the ceiling. Active range of motion AROM is referring to the movement performed solely by the patient moving the joint without assistance. There is no outside force aiding the movement. The previous procedure are repeated. For this movement, ask the patient to raise their arms down by the sides in supination. Bend elbows by bringing the hands towards the shoulder for elbow flexion. Then, straighten the elbow for elbow extension. The same procedure are repeated. For this movement, tell the patient to rotate forearm inward so the palm facing the floor for forearm pronation. Then, return back to the starting position. Next, does the same for forearm supination with the forearm outward so the palm facing the ceiling. Each of the position before are hold for 5 to 10 seconds. Do this exercise in 10 repetitions, 3 times a day, 5 to 7 times a week for 12 weeks. The last part is the evidence base for the intervention.
Based on this article, it states that even though pediatric patients have a rarely required for this exercise, but they found a complete recovery after several months. For the adult, it recommended to do gentle active assisted elbow range of motion after 7 to 10 days after post-surgery. Based on M. Acoli et al. 2018, their study suggests that the patient with Monteggia fracture having a gentle range of motion exercise after 4 weeks of post-surgery. By 3 months, they found the patient has weakened full elbow flexion and extension and also forearm supination and pronation. Burgess et al. 2021 also highlight the use of assistive range of motion exercise after 3 weeks of occurrence of Monteggia fracture, and they found after 6 weeks of treatment, the patient has regained full range of motion of the elbow and wrist with full pronation and also 50-degree leg of supination.
Next, based on a study done by NAF et al. In 2015, they stated that from the examination at 6 months post-operation and range of motion exercise at his elbow, forearm, and wrist, he regained full functionality of the upper limb. Last but not least, Chungmir claimed that based on the results shown in the case study, AROM intervention or exercise together with strengthening exercise did improve the functional capacity of the patient, also making her becomes more independent to perform the activities that requires upper extremities movements.